Okay, the last part of our assessment is going to be the abdominal assessment, but before we go on to that, this is when the patient is lying at a 45-degree angle is when you can best possibly see a small pulsation of the jugular vein, which is visible, and you can also see if there's jugular vein distension, and you can measure the venous pressure if indicated with a ruler. Okay, now we're going to move on to the abdomen. And first, we're just going to inspect it. We're going to inspect the contour, the symmetry. We're going to have them take a deep breath. And just, make sure everything's symmetrical. We don't see any protrusions or bulging or anything anywhere. And with the abdomen, the first thing you're going to do is auscultate. And the reason you're going to do that is because when you percuss and palpate, you could change the bowel sounds. So we're going to auscultate the 4 quadrants, and we're going to start with the right lower quadrant because it has bowel signs or bowel sounds most of the time. We're just going to be listening for high, cascading, gurgling sounds that can be anywhere from any 5 seconds to 30 seconds. Okay, good. The next thing that we're going to do is we are going to palpate. And what we're going to do is we're going to palpate first the intestines down here, which you should hear tympany because of the gas and things in the intestine, and then you'll hear a more dull sound over the liver, which is in the right upper quadrant, and the spleen, which is in the left upper quadrant. We are also going to palpate the liver and the spleen, and the way we're going to do that is we are going to put our hand behind the 11th and 12th intercostal space behind the liver, and we're just going to kind of thrust it forward and have them take a deep breath. And we'll be pointing towards their toes and just kind of feel for the edge of the liver. It shouldn't be tender or anything. Should not be tender. Should just be smooth and firm, just a smooth and firm nodule. We can also palpate the spleen on the other side. The spleen should actually not be palpable unless it is 3 times bigger than it normally should be. But if you can palpate it, it should just be soft and smooth. The next thing we're going to do is palpate the abdomen, and we're going to start with light palpation. So we're just going to go 1 centimeter down, and we're going to gently circle, and don't drag your fingers, lift them. Any tenderness?
No.
We're just going to get a general picture of the area, and then we're going to do deep palpation, which is 6 to 8 centimeters. And we're just going to palpate a little deeper, try and feel the organs, feel for any swelling, any tenderness, anything abnormal like nodules that you may feel. And there should not be any. The next thing that we're going to do is when we auscultate, we can also listen to the aorta by pushing slightly harder with the stethoscope a little to the left of the midline. And we can also feel it by just taking our finger and our thumb slightly left of the midline and just pushing down and feeling for the pulsation of the aorta. And then after we're done with that, we can also test for hernias, and the way that you do that is you just stick your finger in the umbilicus and just feel for any protrusions or anything like that. And while you're in the abdomen area, you can go to the femoral pulse, which is between the pubis and the superior iliac spine, and like I said, just push down and let your fingers up and you should feel the pulsation of the artery. The last thing on the abdomen is just abdominal reflexes. And the way you can do that is you can just take your fingernail and you can just kind of go up and out on both sides and just test the abdominal reflexes. And that is the end of our head to toe assessment.